Alzheimer's disease is a neurodegenerative disease. It is the most common form of dementia. It is a neurodegenerative disease that occurs in the brain. It causes a deterioration in the brain by destroying the nerve cells. Once the nerve cells begin to deteriorate, it causes a reduction of responses to other nerve cells. If we talk about a general definition of Alzheimer, then we come to know that Alzheimer's disease is basically a neurodegenerative disease. It involves the loss of nerve cells or the death of the nerve cells. And the part of the brain that is mainly involved in this disease is the cortex. Here in this diagram, we can easily differentiate between a healthy brain and the brain of Alzheimer's patients. Here we can see that this is the brain of the patient of Alzheimer's disease, and it is shrunken as compared to the healthy brain. So this is how we can identify the brain of an Alzheimer's patient. Alzheimer's disease causes a deterioration in the brain by destroying the nerve cells. So in this disease, nerve cells are destroyed, or the loss of nerve cells occurs, or their death occurs. Once the nerve cells begin to deteriorate, it causes reduction of responses to other nerve cells. This condition spreads out, causing chemical interruptions. Transmission of impulses becomes slow, and finally tissues in the brain begin to get worse. In this disease, nerve cells in the brain die gradually. This makes it increasingly difficult for your brain signals to be sent properly. There are 7 stages of Alzheimer's disease. If we discuss at what age this disease occurs or when do you get Alzheimer's, Alzheimer's disease can occur at any age, even as young as 40 years, but its occurrence is much more common as the years goes by. Early Alzheimer's starts at 65 years of age or younger. Late Alzheimer's starts at age of 65. 1 in 10 people over 65 years of age suffer from this disease, and over half the people over 85 have this disease. At first, the symptoms are difficult to recognize. In the first 2 stages of Alzheimer's, you cannot recognize that you have it. Often, it is difficult to pinpoint when the Alzheimer's disease actually began in a person. So here again we are going to compare the brain structure of a normal person and a person affected with Alzheimer's disease. Here we can see that this is representation of a normal brain, and this is the brain scanning results. We can identify the Alzheimer's brain through the brain scanning, and this one is Alzheimer's brain. We can see that this is actually shrunken, and it is very difficult, very different from the normal brain, and this is the part known as hippocampus, and it is showing that extreme shrinkage of the hippocampus and extreme shrinkage of cerebral cortex part of the brain in Alzheimer's brain. And thirdly, severely enlarged ventricles are identifying Alzheimer's brain, whereas if we see in case of normal brain, there are not enlarged ventricles. Whereas in the Alzheimer's brain, we can easily identify the enlarged ventricles. Here you can easily see that. And also the cerebral cortex parts are not as shrunken as in case of Alzheimer's brain. And last but not least is the hippocampus part of the brain. It is not as shrunken as in case of Alzheimer's brain. Here we are going to discuss some signs of Alzheimer's disease. Top 10 early signs. First one is memory loss, and then changes in mood, misplacing belongings, hard to complete familiar tasks, confusion of time and place, changes in vision, struggling to communicate, poor judgment, and social withdrawal. So these are some signs of Alzheimer's disease. And here are the symptoms of Alzheimer. Short-term memory loss, forgetting recent events, names, and places. Secondly, difficulty performing familiar tasks, disorientation, especially away from your normal surroundings, increasing problems with planning and managing. So in this disease, it becomes difficult to manage and to plan the things because of the part that is involved in these things. To manage these things become disturbed, which is a cortex part of the brain. So due to this reason it occurs. And the other symptoms are trouble with language, rapid unpredictable mood swings, lack of motivation, changes in sleep, and confusion about the time of the day. Reduced judgment, for example, being unaware of the danger. What are the causes of Alzheimer? Researchers believe there is not a single cause of Alzheimer's disease. It likely develops from multiple factors, combination of genetic, lifestyle, and environmental factors that affect the brain over time. So there's not a single cause of Alzheimer's disease. There are multiple factors are involved in this disease. There are 7 stages of Alzheimer's disease. Stage 1 is normal stage. Stage 2 is normal aged forgetfulness. Stage 3 is mild cognitive impairment. Stage 4 is mild Alzheimer's. Stage 5, moderate Alzheimer's disease. Stage 6 is moderately severe Alzheimer's disease. And stage 7 is severe Alzheimer's disease. So the last one is the most severe form of Alzheimer's disease and very critical stage. What are the risk factors that are involved in the Alzheimer's disease? Aging, excessive alcohol consumption, smoking, diet rich in saturated and trans fats, environmental sources such as pollution, speed up the production of free radicals in our body, and that may cause the loss of nerve cells, and that can lead to the Alzheimer disease. Alterations affecting the entire biological pathways may lead to the Alzheimer disease. So there are many other biological pathways that can lead to the Alzheimer disease. There are several factors are involved in this disease, but if we talk about molecular pathway which contribute in this disease, let's talk about them. That involves defects in mitochondrial dynamics and function, cholesterol, fatty acid metabolism, glucose energetic pathways impairments in the brain contribute to this disease. Oxygen is used by the brain in abundance due to its higher metabolic activity, so the brain is more susceptible to free radicals than other part of body. The attack of free radicals on the brain cause memory loss. So these are the molecular pathways which may contribute to Alzheimer's disease if they become defected. So we have discussed about the mitochondrial dynamics and functions, cholesterol fatty acid metabolism's defect, or glucose energetic pathways impairment, and the last one was free radicals attack on the brain. So these are the risk factors that leads to the Alzheimer disease. If we talk about the pathophysiology of Alzheimer disease, so let's start. It involves inflammation in the brain leads to the neuronal loss, which called the neurodegeneration. The pathological features of this disease are amyloid plaques, intracellular neurofibrillary tangles, synaptic degeneration, hippocampal neuronal loss, alteration in amyloid beta precursor protein causes overproduction and abnormal folding of the proteins like beta amyloid and Huntington's tau. So these proteins are involved in this disease, and when there occurs any alternation in these of proteins, that leads to the Alzheimer disease. So the proteins that are mainly involved in this disease are amyloid beta precursor proteins, and mainly beta amyloid and Huntington tau protein are involved in this disease. Abnormally folded proteins form aggregates, and we call these aggregates as plaques in the brain and generates oxidative stress. So in this disease, plaques or aggregates or abnormal foldings of the proteins occurs in the brain, and this causes oxidative stress. Oxidative stress affects the body's ability to detoxify harmful end proteins of metabolism and cause inflammation in the brain. So, due to the abnormal proteins, plaques occurs in the brain, and it leads to the oxidative stress, and this oxidative stress leads to the inflammation in the brain. So in this diagram, we again see the comparison between a healthy brain and a Alzheimer brain. So Here we can see that this one is going to represent a normal function of the neurons in a normal brain, whereas in the B diagram we can see there are neurofibrillary tangles and amyloid plaques. So these plaques are representing abnormal proteins in the brain, which leads to the Alzheimer's disease. And in C diagram we can see this one is healthy brain and this is shrunken brain is again the Alzheimer brain. Moving forward, we can see what occurs in the Alzheimer disease. Tau protein's abnormality may lead to this disease, and neurofibrillary tangles and tau protein's abnormal function lead to the oxidative stress in the brain and causes problems, and loss of memory occurs. This is representation of tau aggregates, how the tau proteins aggregates and form the plaques in the brain, and this tau propagation is representing the Alzheimer's brain. What are the treatment for this disease? There is no known cure for Alzheimer's disease. It is not possible to reverse the death of the brain cells. Treatments can, however, relieve its symptoms and improve the quality of life for a person and their family. Doctor may recommend medications for the symptoms such as antidepressants for low mood, anti-anxiety drugs, antipsychotic drugs for hallucinations, delusions, or aggression. Two types of the drugs are currently used to treat cognitive symptoms. Number one is cholinesterase inhibitor, and number two is Namenda. These two drugs are currently being used for the treatment of cognitive symptoms of Alzheimer's disease. So, this was all about the Alzheimer's disease symptoms, signs, and the treatment. Thanks. Stay connected for further information related to science.